Good morning, class. So today our topic is about digestive system. So this is part 1. So this is our module 20. Okay? So when you say digestive system, so 'di ba ang digestive meaning ang process kung gina-intake ta na ang food, 'di ba? So, digestive system is essential for processing food and extracting energy to produce ATP. So, di ba ang ATP is energy, adenosine triphosphate. So, which powers various bodily functions, so including ang muscle contractions and neuronal activity. Okay, so if wala ATP, since ATP is energy, then if hindi kita mag-eat, we have no energy, right? So, muna siya. So, muna siya ang, kumbagang, importance ng digestive system naton. So, ang digestive system naton is consist sang digestive tract and gastrointestinal tract or ang GI tract naton. So, consist na siya sang oral cavity, pharynx, esophagus, stomach, small and large intestines and anus. Okay, oral cavity. So, this one ang i-highlight ko. So, may mga specific associated organs kita, like ang salivary glands and liver and pancreas. For the oral cavity, so, ang oral cavity, entry point for food. So, dira dira ang entry sang aton nga pagkaon. So, muna siya aton mouth, aton mga teeth, muna siya. So, ang pharynx naman. So, pharynx connects the mouth to the esophagus. Okay? So, ang stomach. So, of course, dira gina-store gina-digest ang food. Okay? The small intestine is like the primary site for digestion and absorption. And the large intestine naman absorbs water and forms waste. Okay? Then lastly, aton nga rectum or ang anus is the final section for waste elimination. O dira nagagwa ang waste products naton. So, functions of digestive system. Okay, wait. So, for the accessories, gali, nga other, like ang aton salivary glands, of course, produce saliva to begin the digestion. So, di ba, we need saliva para mag-easily pass down ang food from our mouth pakadto sa aton nga GI tract. Okay? So, ang mga gallbladder, liver, and pancreas to produce bile and digestive enzymes. Okay, so functions of digestive system is number 1, ingestion, number 2, digestion, number 3, absorption, and 4 is elimination. So here we have the major tunics of digestive tract. So may ginatawag kita nga lumen. So ang lumen nga na ga-compose na siya sang ang mucosa, submucosa, malaris, and serosa. So, ang lumen is like the open space inside a tubular structure sang GI tract naton that allows food to pass through. Okay, so, kumbaga, ang lumen is like, kung mo ni siya ang tummy naton. So, kung mo ni siya, diri ang lumen. Okay, then ang GI tract, ga-compose na siya sang mga layers from here. Okay, so, number 1 is the mucosa. Okay? So, ang mucosa is the innermost layer of the stomach wall. So muna siya. Ang innermost layer na siya, ha? So, consist na siya sang mucous epithelium, lamina propria, and muscularis mucosae. And next is submucosa. So, contains plexus where autonomic nerves innervate. So, contains inflammatory cells and lymphatics, autonomic nerve fibers, and ganglion cells ang submucosa. And ang muscularis externa naman is meaning thin layer na siya sang third layer na siya sang aton nga digestive tract, ang muscularis externa, meaning externa, outside. So, sa outer. Okay? May kita outer kag inner sina actually. Then, third layer na siya, di ba? Bakot fake muscles that helps mix food with digestive juices. And the serosa is the outermost layer which wraps around the stomach to confine it. Okay? So, consists of peritoneum or ang ito nga adventitia or ang adventitia is regions not covered by the peritoneum. Okay? So, anatomy of oral cavity. So, muna siya. Diba? Ang bako gina-compose adra na sa mouth naton and teeth. Diba? So, aton nga oral cavity, first part of GI tract, bounded by the lips and cheeks and contains the teeth and tongue. So, ang frenulum nga na is ang diri balaonan. Ara siya, ang sa babaw, ang ga-connect na bala, kag ang diri o, nan. Ang do thin na siyang skin, muna siya ang frenulum. So, ga-provide na siya actually ang frenulum sang support sang aton lips pakadto sa aton mouth. It's because kung wala ni antang naton, kung wala ni sila, then do hindi siya makasupport, di ba? Hindi siya mag-stick gid, so do loose skin na lang nga matabo sina. Okay, so ga-provide siya support, okay, sa aton tongue kag ang sa aton nga upper lips. Kag actually may sa upper lips lang na siya kag sa dalom sa aton tongue. Okay, so ang teeth naman naton, so of course for chewing of food, aton teeth. Okay, so located in mandible and maxilla that can be divided into 4 quadrants with each contains 1 central and 1 lateral incisors. And when you say incisors, ay sila ang sa babaw. Okay, mani dira o. Mani ang incisors, ang sa front na naton. Okay? So sa babaw kag sa dalom. Okay? And so also we have one canine teeth and first and second premolars and first, second, third molars. Okay. So ang premolar naton is this one and ang aton molars is ang pinaka-last. Okay? So ang permanent teeth or ang secondary teeth naton is we have 32 permanent teeth. Okay? So 16 in the upper jaw and 16 in the lower jaw. Okay? So primary teeth or deciduous teeth or milk or baby teeth lost or replaced during childhood. So 20 in number na siya. So 'di ba kung toddler kita, bata, baby pa, 'di ba ang baby wala pa siya sang teeth, 'di ba? So awkward man na kung may ara sang teeth ang baby, sang newborn baby. So 'di ba gat amat-amat siya tubo, then wala na siya ang baby teeth naton, then gaamat-amat siya gamat-amat na siya kakas, then magiging permanent teeth na naton. Okay? So ang wisdom teeth, so last na siya gatubo, so the third molar that appears in early 20s. Okay? So pinakadulo siya. Okay? Ang wisdom teeth naton. So regions of tooth. So we have the crown, so visible portion. Then we have the neck here and the roots. Okay, we have the roots here. Na siya. So, pulp cavity. So, center of tooth that contains pulp and is surrounded by the dentine. So, ang dentine, okay, wait lang. Wala ko disang, okay. So, ang dentine na siya ha. So, hard na siya and calcified tissue that makes up the majority of tooth. So, located beneath the enamel and cementum. Okay? Wala ko there isang illustration. Okay. So, part na siya kung ara ang tooth naton, dire man na siya, oh. Ang dentine. So, di ba ang enamel, dire man na siya. Okay? So, susulod. So, ang enamel naman, extremely hard, a cellular substance that protects tooth against abrasions and acid. So, importante gid ni ang enamel actually, kay muna siyang ga-protect gid sa aton teeth. So, kung wala ang enamel, nga na, tendency, kung wala may ma-protect sa aton teeth, sa mga cavities. Okay? So, mga sugar nga ginakaunta. So, dasig, guba aton teeth. Okay? So alveoli, where the teeth are held in place along alveolar process, which are covered by the gingiva or gums. Okay, so and secured by periodontal ligaments through embedding into cementum. Okay, so kung example, for the gingiva or gums naton, so example, if mayara bacteria nga ga-build up sa tooth or sa teeth naton, ga-build up sa teeth. So most common disease nga pwede makuha sa aton gums is gingivitis. So gingivitis is the inflammation of our gums. So pwede na siya maging swollen, red, or ga-bleed sometimes naman na siya. Okay? So, pwede man na siya dapat, to avoid having gingivitis, dapat we must have good oral hygiene. So, including brushing, flossing, and also, dapat muna toothbrush kagid or mouthwash kagid always. Okay? So, hindi man contagious ang gingivitis. So, next we have the palate or ang roof sang aton oral cavity. Okay? So, that prevents food from passing into nasal cavity during chewing and swallowing. Consists of hard palate and anterior and soft palate and posterior. So, ang uvula. Ang uvula naton, amo na siya. This one, muna siya ang uvula. Okay? So, posterior extension of soft palate. Okay? So, ang uvula is a soft teardrop shape na siya. So, you can see here, the teardrop shape. Ang uvula naton. Okay? So, gahang lang na siya sa aton roof, sa back sang aton nga roof sang aton mouth. Okay? So, uvula prevents choking. So, ang uvula triggers the gag reflex when food or passes or food and liquid pass into the back of the throat. Okay? So, muna man siya ga-prevent man na ang uvula naton from food and liquid from going up to the nose. So, when you swallow, the uvula and soft palate move backward. Okay? And also, your uvula keeps your mouth hydrated. Okay? So, it also forms certain sounds and some languages also. Okay? So, next we have the salivary gland. So, produce saliva, of course. We have three major pairs. So, parotoid gland. So, largest located anterior to each ear, which parotid ducts enter oral cavity adjacent to the second upper molars. And submandibular glands felt as soft lump where submandibular ducts open into the oral cavity on each side of the frenulum. And sublingual glands, smallest and primary mucous secretions, which each gland has 10 to 12 small ducts opening onto the floor of the oral cavity. Okay? So, saliva. Of course, ang bako gani, important gid ang saliva in order for... Okay, noted. So, saliva. So, ang bako important na siya, okay? In order for the food to pass through from our mouth. Okay? So, mixture of serous and mucous fluids that is secreted at the rate of approximately 1 liter per day, which is regulated by the autonomic nervous system naton. Okay? So, primarily, the parasympathetic nervous system has many functions. Okay. Oh no, wait. So, medyo sala aton nga module. So, ang saliva is regulated kidya by the parasympathetic, ha? Not this one. The parasympathetic nervous system. So, it has many functions that includes it helps keep the oral cavity moist. Okay? So, mucin nga na. Mucin is a proteoglycan from mucous secretion that gives a lubricating quality to the secretions of glands. So, contains enzymes that begin the process of digestion. And And also we have the salivary amylase. So salivary amylase breaks down the starch. Okay, so prevents bacterial infection in mouth with a mildly antibacterial enzyme called lysosome. So, neutralize pH. Okay, mastication and chewing begins the process of mechanical digestion, breaking down large particles into smaller ones. Okay, so pharynx, only oropharynx and laryngopharynx carry food to esophagus. Okay, so you can refer sa previous video ko ang illustration ko sa aton nga GI tract or sa digestive system naton. Okay, so esophagus is muscular tube about 25 centimeter long that passes from pharynx to stomach, contains vital sphincters. Okay, so ang sphincters nga na. Okay, so we have upper and lower esophageal or sphincter naton. So sa upper, wala lang ko di drawing, pero sa may throat na siya, after sa may throat naton, so sa esophagus area, so meaning sa babaw. So located at the upper ends that regulate the movement of food into the esophagus. And we have the lower esophageal or cardiac sphincter. So located at the ends that regulate movement of food. So diri na siya ang lower sa may sa may stomach na naton. Okay? So, muna siya ang ga-close or open. Okay? So, ga-regulate na sa movement sa aton food. So, ang ginatawag ko din nga GERD or ang gastroesophageal reflux disease, sometimes, di ba, normally dapat close. Normally close, kaya dapat after mag-pass ang food, ga-close ang aton sphincter. Okay? So, sa gastroesophageal reflux disease or ang ginatawag nga GERD is ga-open or sphincter, ga-open ang sphincter naton. So, gabalik ang acid sa babaw or ang food. Okay? So, muni sila ang phases of swallowing and deglutition. Okay? So, muni sila. Okay. So, you can screenshot if wala. So, next we have the stomach. So, houses food for mixing with hydrochloric acid and other secretions. So, amo ni sila ang structures aton stomach. Okay? So, actually, ari naman diri sa aton nga chart. Okay. So, ang chyme. So, semi-fluid mixture of food na siya. Okay. So, I think ara na siya sa biochem ninyo ang chyme. Okay. So, ang chyme is a thick semi-fluid mass of particular digestive food and digestive secretions that is formed in the stomach and intestine during digestion. Okay. So, secretions of stomach. So, meron kita mga hydrochloric acid. So, ga-produce na siya sa pH of about 2.0. So, acidic na siya. That kills microorganisms and activates the pepsin. Okay, so pepsin activate form of pepsinogen that breaks down protein. Mucus forms thick layer that lubricates and protects epithelial cells from damaging effects of acidic. So, mucus forms thick layer that lubricates and protects epithelial cells from damaging effects of acidic, chyme, and pepsin. Secretions can be stimulated by stomach irritation. So, intrinsic factor binds with vitamin B12 to be readily absorbed in small intestine. Okay. So, we have here phases of regulation of stomach secretions. So, we have here cephalic phase. So, ang cephalic phase is get started na siya. Okay, get started. Stomach secretions are increased in anticipation of incoming food. And gastric phase naman, go for it. So, change na lang. So, ang gastric phase, go for it. Okay, so greatest volume of gastric secretions occurs due to presence of food in the stomach. Okay, so ang cephalic ha is incoming anticipation of incoming food. And gastric is occurs due to presence of food in the stomach. So ara na. So intestinal phase is slow down. So inhibits gastric and secretions as the acidic chyme enters in duodenum. Actually, ari ni sila nasa biochemistry ninyo. I think it's module 20. 20 man, I think. Okay. So muna sila ang mga hormones naman naton. So gastrin enters blood and carried back to stomach, stimulates additional secretion activity. And histamine enters blood to stimulate gastric gland secretory activity, most potent stimulator of HCI secretion. And secretin released from duodenum in response to low pH inhibits gastric secretions. And cholecystokinin or ang CKK naton activated by fatty acids and peptides in duodenum inhibits gastric secretions also. So all of this ara naman sa biochemistry. So dugin-dugang lang siya di. Okay, so movement sa aton stomach. So contractions sa aton stomachs occur every 20 seconds proceeding from the body of the stomach toward pyloric sphincter. So may araan kita ginatawag nga ang peristalsis nga na is wave-like muscle contractions. So ara na dira o. So ang peristalsis ang aton sa GI tract na siya. Para kung wala peristalsis meaning hindi siya makaagi ang food hindi makaagi mayad pakadto sa stomach ta. So need na nga mag-okay gid ang peristalsis. Okay? So wave-like muscle contractions that move food through the digestive tract. Okay? So ayan man kita mixing waves, relatively weak contractions that thoroughly mix ingested foods and form chyme. So ang peristaltic waves, stronger contractions that force from chyme toward and through pyloric sphincter, causing partial relaxation. And hunger pangs. Ang hunger pangs is growling of the stomach. Okay, though di ba mabatian nyo, gagrowl aton stomach sometimes. So when gutom kita. Okay. So growling stomach, uncomfortable sensations that can build up to prolong or tetanic contractions. So peristaltic waves triggered by low blood glucose levels from empty stomach occur for about 2 to 3 minutes. And distension of wall stomach, meaning distended dako. Okay? Dako aton siyan gadako, distended. Major stimulus gastric motility and emptying must be regulated. So, sometimes, pwede siya maging too fast, efficiency of digestion and absorption in small intestine is reduced. And too slow, highly acidic contents damage the stomach wall. So, sometimes, tungod distended aton siyan is sometimes grabe ang gases nga ara da, di ba? So, muna, may mga times nga muna daw dako aton siyan. Okay? So, vomiting. So, vomiting, protective mechanism against the ingestion of toxic or harmful substances. So, harmful substances. So, tendency ang body naton automatic na once nga may ma-ingest kita nga toxic, isuka tagid na siya. Or we tend to vomit the toxic, ipagwa gid na siya. So, that's why sometimes when you ingest toxic waste or guba na food, so, di ba, ang tendency ma-LBM kita, ma-diarrhea kita. So, sometimes, hindi mo need danay pag you don't need to take danay like loperamide or mga anti-diarrhea na medicine if mga once lang kita nag-LBM. Kay, muna gidya ang tendency sang body naton nga ipagwa or eliminate ang waste or ang toxic nga na. So if anti-diarrheal medicine ka na once ka pa lang nag LBM, sometimes sa din magwa ang toxin, di ba, sa mangita siya pagwaan. So ma-vomit ka, masuka ka. So once magsuka ka, sige ka nga suka, manubo naman ang potassium mo, magiging alkalotic ikaw. 'Di ba? mana siya. So, protective mechanism na siya against ingestion of toxic or harmful substances. Pero sometimes, harmful man ang too much vomiting. So, dapat ma-refer na ina kung too much na. Okay? So, that's all for part 1. Thank you.